and let's talk mental health this morning. I am Dr. Jennifer Mann-Mackey with Wayne Behavioral Health Services. I am the clinical director and provider for Wayne Behavioral Health Services. And this morning we have some very important topics that we want to cover. Number one being that September is National Suicide Prevention Month, so I felt like we needed to touch base on that. We wanted to talk about suicide, and we do know that there is no specific leading cause for suicide, but there are risk factors that we can look for. So I want you to get your questions this morning, get your questions going. We are live on Facebook, and we're live here. And this month we're going to talk about also access and mental health care. How do I go about getting help for myself or for a loved one or for a family member? What do I need to do if I think I have a problem, if I'm feeling sad more than usual, if I'm having problems with anxiety or stress? What do you do and what do you think that you can do? So let's look at some risk factors. Number one, when we talk about suicide and we talk about suicide prevention, we know that it's a very sensitive, it's very touching, it's a very touching subject, and it's something that we don't always like to talk about. It makes us uncomfortable. But part of my story is, and I'll tell you my story during Suicide Prevention Month. Part of my story was I was a sophomore in college when I attempted suicide. And I was a sophomore in college. I was at the University of Southern Mississippi, and I was depressed. I had gone through my first relationship out of high school. It did not work out, and I was sad about it. And so what happened was one day I came in and I attempted suicide, and I took an overdose of pills. And my neighbor saved my life. It was my neighbor that called another neighbor, and they got me to the ER. And of course, they did the work on me and saved my life. So that's why I serve in mental health today, is because somebody saved my life. And I'm in the business of helping others process their pain, process their grief, process their loss. And so that's why I'm here, and I understand suicide. It didn't just start when I was a sophomore in college. I had all other risk factors and things that were going on even in my childhood, from child sexual abuse all the way up to trying to survive being a teenager. I was a horrible teenager. So I was one of those non-compliant teenagers, and so I'm here today because somebody saved my life, somebody reached out to me, and I'm hoping today by us having this conversation and that you too will reach out to others when you recognize that something is off or something is not just right. So let's look at historical environmental issues or things that sometimes we don't pay attention to in our environment that causes us sometimes for people to think about suicide. Sometimes people have access to lethal means, which means that our guns, our weapons are not secure, they're not locked, and then teenagers can have access to them. That's one of the number one things. If we look at a survey of our environment, we want to make sure that our lethal means are under lock and key, and that kids don't know where the keys are, or adults that are at risk don't know where the keys are. Number two, when in the environment, when people feel that they're being harassed, or relationship problems, or unemployment, when finances are low or money is not coming into the family, sometimes in the environment that creates an environment where you're at a higher risk to want to give up or want to quit. So you want to pay attention to things like that. Also, when you're exposed to other people's suicide. I was told that before I moved into the apartment as a sophomore in college, that the person that lived there before had committed suicide as well. And I think that's ironic. However, he was playing a game of Russian roulette under the influence, and he killed himself. And so, you want to think about making sure that when you lose a loved one to suicide, or you lose a loved one, that you reach out, that you tell people what you're feeling, and that you reach out for help, because that is a major risk factor when you think about the environmental influences of suicide. And then let's talk about some of our risk factors that's health related. For instance, if you're feeling depressed, or you're feeling sad, or there's substance use or misuse problems, or bipolar disorder. Sometimes people are not treating their disorders. Schizophrenia, personality traits such as aggression and mood changes and things like that, conduct disorder. And these are specific disorders, but things And I don't want to get into the details of that, but we can, if somebody have questions about specific disorders that I'm describing. I'm just trying to show you some of the health factors, risk factors that can sometimes lead to suicide. We know there's not one single thing, and nobody can. As a matter of fact, I had no plan when I attempted suicide. There was no plan. There was no plan. I had no idea or anything, but I was a parent pleaser. I was one of those that did not want to fail my parents. I was one of those that did not want to fail people in my community, and so that became my option. And I'm grateful that the Lord allowed me to survive that. Other things is serious physical health conditions. Sometimes people feel that they're a burden to others because they have serious physical health issues, and that they're not as vital as they used to be, that they don't have the same physical vitality that they used to have. So sometimes when people feel that they're a physical burden or financial burden, sometimes people feel like they should give up. Also, one of the other risk factors that, in particular, not just military, a lot of times when we talk about post-traumatic stress disorder, we're just thinking that we're talking about veterans, and we are talking about veterans, but we're also talking about people that have experienced traumatic events that may not be a veteran, maybe never served in the military, but clearly there have been traumatic events in your life that you've never dealt with or never got help for. So when you see where there's an increase of trauma in someone's life, there may be a higher risk for suicide. And mind you now, this is all subjective. Everybody that has trauma will not even attempt suicide. Everybody that has depression will not attempt suicide. We're just acknowledging that these are risk factors, and for some people these are risk factors, and put them in a higher rate risk for committing suicide or attempting to commit suicide. Usually when we look at the risk of suicide, we look if they've had any prior attempts or any prior thoughts of suicide. We look at, have they had some successful, almost near successful attempts. We look at the family history of suicide. We also look at child abuse. We look at neglect. We look at trauma. And so when you're looking at, when you're thinking about suicide prevention, survey the environment. See if you're leaving things accessible to people that may be vulnerable, that's having unusual levels of stress. See if, people are misusing or using substances to cope, to get through life. Recognize sometimes we don't always like to confront pain. We don't always like to confront issues. And it's really not a negative confrontation, but sometimes people are in need of an intervention. And when we ignore the possibilities and the opportunities given to us to intervene, now mind you, not all times we can intervene, but when we can, we should try to intervene. So there is a National Suicide Prevention Hotline. That number is 1-800-273-8255. The National Suicide Prevention number is 1-800-273-8255. And also our wonderful state, the Peach State, Georgia Crisis Hotline, if you recognize someone or you know someone is in need immediately, or you can't get them to move physically to come to a local provider, that number is 1-800-715-4425. 1-800-715-4425. And if you watch Wayne County Television TV 16 or their Facebook Live, it's one of the crawlers at the bottom where they also have these numbers on there. And also our local urgent mental health number, 912-318-3317. So I just wanted to touch base on the risk factors for suicide. Don't want to pull your morning down, because we know that it's good news when we can learn how to help others. However, sometimes it brings up bad memories or memories of people that you've lost, and that's certainly not what we're trying to do. We are trying to prevent further harm or hurt to anyone else. We want them to know that there is help and that they can get help and that they're not alone. Also, for veterans, there is a veterans hotline. I'll have to get that number for you, but there is a veterans hotline for military and veterans that can call in and get the support that they need through the VA. So if anyone have questions, please, I'm going to glance over and see if anybody posted any questions on Facebook Live. I want to thank you for joining us, Facebook. Hello, good morning. Thank you. I see you. I don't want to call your names out, but good morning. Thank you for being with us this morning. Okay, so our next topic this morning, we're moving right along, is we want to talk about access to mental health care. And what am I talking about when I say access to mental health care? I'm talking about, how do I get the help that I need? I feel like my child, my son, my daughter, my grandchildren, myself, I feel like there's something that's going on, but I don't know what to do or how to do. I just know that something is off. And you know when people are not behaving the way that they have in the past. Maybe they're losing interest in hobbies or activities. Maybe they're staying in their room more than usual. Maybe they're sleeping a lot. Maybe they are crying a lot. Maybe they are talking about death a lot, or talking about a loved one that they lost. So you just want to be on the safe side. I think prevention is always better than being sorry later. It's always better to try to get them triaged, to get them assessed, to see if anything is going on. And sometimes I got to be honest with you, people are not comfortable always sharing about their emotional health. They're not comfortable sharing that they are struggling. They're not comfortable talking about, even not sleeping well. Over a period of time, not sleeping well can lead to other mental health issues or behavioral issues, and can definitely increase irritability. And a lot of times the thoughts are just racing in their minds, and they don't know how to shut it off. So when you think about access to care, the number one thing I want you to do, I want you to take out your insurance card, and I want you to call your insurance carrier first and see if you have eligibility for mental health care, if your insurance will cover mental health. And also what would happen is, if you need to be referred to somebody or you want help, that is a starting point for your insurance carrier to refer you to someone that's in your network that will be covered under your insurance. So then you don't have to worry about all the outage, extra pay, all the extra costs or anything like that. Start with your insurance carrier to say, look, I need access to mental health care. I feel like something is going on with me. I feel sad. I'm feeling all of these things. Or even if it's for your child, start with your insurance carrier, and they will refer you, their case manager. Usually it's a clinical nurse or it's another licensed provider that will make sure that you get the referral to somebody in network for your insurance, number one. Number two, you can always tell your family physician, or family care physician, or primary care physician that you feel you need to talk to someone. And that primary care physician can refer you out, okay? You can always tell people to help you negotiate that. And let me tell you, there is also another thing that you can do that does not require a referral. You can self-refer. You can refer yourself. You can walk into any of these agencies. You can walk into Wayne Behavioral Health, or you can call us and make a referral for yourself. You can walk into Pineland Mental Health, Wayne Counseling Center, which is Pineland Mental Health off by the defects, and you can walk into them and say, I need help. Or you can call them likewise. You can call Anchored in Wellness. You can call any of the behavioral health providers in the community, and you can access mental health care. It is that simple. And it is that easy. Now let me tell you, when you walk in to get care, what happens is the provider's office or staff will verify eligibility. They will contact your insurance, and they will ask your insurance, is this person eligible for mental health care? And if so, do they have a deductible? Or, because a lot of times people don't realize this is something you have to check. Because of the times that we live in, sometimes mental health copay deductibles are like $10,000, $5,000, because people don't expect to ever use that part of their insurance, so they don't really invest in it. So you need to check that before you need to have it. especially if you have teenagers, especially if you have children that maybe have some level of emotional concerns to you, or even yourself, that you recognize, especially during COVID-19, that you're feeling overly sad. And if you've lost loved ones like I have due to COVID-19, and you didn't get to say goodbye, sometimes you have those unresolved issues that you want help with. So make sure that you understand. Number one, call your insurance carrier. Number two, you can walk into, have your primary care physician to make a referral, and even your specialist physicians can make referrals. Number three, you can walk in on your own, and you can walk in. Now, mind you, sometimes people have heard so much about mental health care that they are afraid, they feel like there's going to be so much stigma attached to them trying to get help. And let me say this, there is stigma about any and everything. And we have to try to shatter that stigma by saying, you know, if I have a physical health issue, I'm going to go to my primary care physician. And we need to say, well, my mind is just, my mind and my mental issues is equally important as my physical health. And so we need to break and shatter those stigmas and say, look, I need to go get help for my mind. I recognize that something is not wrong, something is not right. So neuroscience is just as important as it is for physical health as it relates to, they're co-joined, there's no separate, and I think that's what people don't understand. When you have mental health issues, people think that's outside of the physical, but it's not. It's all part of your brain, your cognitive functioning. All of that is a part of that that profile of your physical health. So I want you to consider and think about that as you consider and accessing mental health. Now, I will say that when you come for mental health counseling and you start your process, the process is something like this. I sort of want to just share with you what a day would be like. So say Miss Vicki comes in, and Miss Vicki is coming in and she wants help, and we're going to sort of like role play.
I'm Miss Vicki.
So Miss Vicki is going to share what she's needing from us.
Okay. If you'll hand me the cell phone, I'm going to move it over here so they can see both of us.
Okay.
All right? Let's see here.
Okay.
All right. Now, there we go. All right. Miss Jennifer, I need help. I need help, Miss Jennifer.
So what's going on?
I'm so sad. I feel sad all the time.
How long have you been feeling sad?
Oh my goodness, it's probably been all my life. It's like I just can never get happy. I get, it's like everybody else seems like they're normal and I'm not normal.
You're absolutely normal. We all go through sadness. We all go through bouts of sadness. We all have these things. Now probably what we should do is we should do a clinical evaluation to determine maybe the root cause of where this is coming from so that we can help you better.
Okay.
And so what we would do is we'll ask you a series of past family history, lifestyle type questions, and we'll also ask you questions about your medical health to see if there are any things that's going on with you physically, could also contribute to your mental health. We will also see right now in the presence if there are any signs of suicidal thoughts or homicidal thoughts, thoughts to do harm to others is homicidal thoughts, or suicidal thoughts, thoughts to do harm to yourself. And we'll try to rule those things out. We'll also ask questions like, is there any family history of mental health issues? If there's any family history of diabetes, any family history of whatever, we're going to look at family history real close, also along with your personal history in the present right now. So we call that a clinical evaluation, and it takes a licensed person to do that. It's not just any ordinary person that would do that evaluation or that assessment. So when you first come in, you're calling. We're just going to say you're calling.
Right. I've called and I've said, I think I need help and I need an appointment.
Right. And so we're going to get her an appointment as soon as possible. One of the things that the care team will ask you will say, hey, are you having thoughts of suicide right now? You know, when you call in, we're going to ask the question, are you having thoughts of suicide right now? Are you having thoughts of harming yourself or others? If they say no, we will proceed and give them the next available appointment.
Mhm.
If not, we will ask them to either come to see us, or we will ask them to go to the nearest emergency room.
Gotcha.
Because they're having thoughts of suicide. Now, when they come in, again, I told you, we'll take your insurance card, we'll take your license, we'll get you verified, all that kind of stuff. And sometimes if we can get it over the phone, we'll have you verified before you come in, meaning with your insurance carrier. And then the next thing we'll do is establish that little clinical evaluation where we determine what your diagnosis would be, whether you would be diagnosed with depression, whether you be diagnosed with anxiety or generalized anxiety, or whatever that diagnosis would be, based on your history and what you've shared with us.
Right.
Okay? And
So I have to be honest.
You have to be honest.
Yes.
Right. You have to be honest, because why? We're relying on you to share, and there is no shame in your history.
Right.
I purposely share with you guys this morning my history, something that probably nobody in Wayne County knew. I personally share with you my passion, my push for mental health. Why? Because I wanted you to feel safe enough that you could come to me. Well, Dr. Mackey has gone through this herself. You know, I fought through suicidal ideations. I fought through a suicide attempt. And so I understand exactly what you may be going through. And also I understand sometimes the shame that's associated with it. But I chose to live, and I'm asking you guys to choose to live by seeking out that good help. So after your clinical evaluation is done, Ms. Davis, what happens is then you and I will work together on a treatment plan. We will work on the course of action based off what you have shared. If you tell me, you say, I'm suffering with depression, you said, I've been crying, I have been having racing thoughts, I'm really not eating like I should, I'm barely sleeping. And so, okay, so based on those symptoms, let's just rule out depressive disorder, NOS, not otherwise specified.
Right.
So we're going to start at that baseline and say, okay, now let's look at your treatment plan. What is the first thing that you would want to consider? Are you know, let's say you're not sleeping. Let's say we want to improve sleeping.
Okay.
As a part of your treatment plan. And so if we're going to improve sleeping, then let's see what we need to do. Do we need to turn the TV off at a certain time? Do we need to perhaps do some meditation before we go to bed? It's all going to be what you're willing to do.
Right.
The treatment plan is not for the therapist to do.
Right. Because if I don't do it, it's not going to help me.
Right.
Yes.
So the treatment plans is a course of action that I'm just helping you and supporting you to come up with. And then we check in periodically, like every 3 weeks, every 30 days, every 90 days, to see how you're doing with your treatment plan. And that's what we go by. So it's real simple. And then sometimes providers will want you to come in weekly based off of what your need is. If a person is really in a sort of an acute mental health state where the anxiety, panic attacks, all of these things are so high, and they're really stressed and nervous and just can't rest at all, sometimes they'll ask you to come in weekly just so they can get you stabilized and get you to where you're calmer, where you can feel like that you're supported and that you're getting this stuff off of you through talking and through counseling and through therapy. And then sometimes they'll put you on a schedule every 2 weeks because it's going to be based on medical necessity. We don't just fill our schedule. That would be good for us if money was all we were looking for. That's certainly not all of what I'm looking for. But what you have to recognize is that everything is based off medical necessity, because sometimes you may feel that you need more, but the clinician has to base it off what you have given her in that product of that evaluation. And so she can't just say, I'm just going to have you come every day because the insurance will pay for it. Right? I'm going to have you come every day for the next 6 months. Well, is that really a medical necessity?
No.
So medical necessity would dictate how often and how much you would be seen by a therapist, just like you would if you were going to a physician. Insurances will not pay just because you want to come in every day. However, it's a streamlined process. It's an easy process. From the time that you call to the time that you get your evaluation done, your treatment plan set, and a diagnosis is established, There you go. Now let's say you need specialized treatment or you need some specialized care that cannot be done in the local mental health office. I think Pilot Mental Health does have psychiatric assistance once a month, or however they're doing it now. Myself and probably Anchored in Wellness probably are referring out. I think they may have a nurse practitioner. But we have partnerships and partners with psychologists, partners with psychiatrists that we will send you to. And I know for myself, I've gone through a few psychiatrists. I'm going to make sure the psychiatrist is paying attention to my clients, meaning that I've had clients in the past that have said that when they go to see a psychiatrist, sometimes they're on the dictaphone and they're working, you know. And I feel like that's a disservice to the people that we send to them. And so my goal is to always connect you with somebody that I know that their bedside manner, so to speak, is giving attention to you.
Excuse me.
And so what I want you to understand is access to mental health care is not complicated. It's really, really more simple than what you think. I think the biggest and the greatest barrier is ourselves being afraid to take that first step. And so in anything that we do, there's a first step. In anything we seek out help for, there's a first step. And after you recognize how smooth it goes and how the first step is really just that, a first step, you'll see how easy it is to get the help that you need and not prolong the help. Let me say this, if you have children, I want to mention this as we talk about access to mental health care, because I think what happens is sometimes we recognize risk factors in our children, and as parents it's very hard for us to admit that our sons and our daughters need help, especially if they're elementary, if they're in middle school, if they're in high school. Sometimes we delay access and care because we feel like it's going to get better. But it doesn't. So it's better to get the kids connected to a mental health provider that can teach them the tools and the skills that they need in order to be successful in school, in order to be successful in life, and increase their coping skills. And I know it's hard for me to, it's hard sometimes for us to believe that children need help. But I'm going to give you an example. I was a contractor once for the Daisy Clinic in Waycross some years ago. And a grandfather brought his granddaughter in. Just give you an example. And I thought, oh, what a beautiful little girl, just a gorgeous little girl. And I just thought, oh my goodness, she's so beautiful. And they were describing behaviors to me that I was just like, there's no way that this young person is climbing shelves and doing things, that she would be that driven through her ADHD. She had the hyperactivity part, and she was all over the place. And what incident that actually got them there was that she just broke away from her grandfather one day and just was running and almost got hit by a car. Because, you know, sometimes children with ADHD are so driven that they're not paying attention sometimes in the moment, and sometimes that hyperactivity just has them going like a motor. They're running and moving like a motor machine. And so he brought her in because that frightened him so much, because he was an older man, and he, you know, in this generation, grandparents are rearing grandchildren at an alarming rate than usual, usually due to a child having an addiction issue or other issues or loss of a parent. So this, when I saw this child come in, I couldn't even do the assessment on this child. She was climbing my bookshelf.
Oh my gosh.
In the office, the grandfather had to remove her off of my bookshelf. I could not believe it. I became a believer of therapy with medication on that day. I had always been a supporter of psychotropic meds for young people or children. I think it needs to be a clear medical necessity. I think there has to be some clear, convincing evidence after we've tried everything else, after we've looked at their diet and say, okay, can we remove things from the diet that breaks down into sugar that cause them to be more driven? I believe that we can manage some of this by our children's diet. You know, getting rid of that sweets and red punch and white bread, and Getting rid of all the refined sugars out of their diet can possibly be one of the best things you can do, especially when you have children that potentially could have ADHD. And so what we did, we recognized, we referred her to the psychiatrist. This student, I tell you, she was unrecognizable by the fifth visit after the medication had got into her system. She was unrecognizable. I'm telling you, her grades had increased, her social skills had increased, because what you don't understand is that when your children have behavioral issues or mental health issues, sometimes they don't develop socially, which means that they have a hard time making friends, they have a hard time following instructions, they have a hard time listening, and they have a hard time completing tasks. And so they're redirected all day long by the teacher, you know, come on, let's get your work done, come on, let's finish your homework, let's finish your assignment. And they just cannot do it. And you have to understand that it's not that they don't want to do it, it's not that they have a learning disability. Sometimes they just don't have the focus to get the work completed because they're daydreaming or they're off somewhere else. So don't wait till it's out of control to access mental health care for your children. Mental health care is important for everyone. If your children have experienced a trauma, don't just say, oh, they'll get over it. You know, come on, you can bounce back. It's going to work out. Yeah, just rule it out, because sometimes children don't always express what they're feeling. And then some children, when they've experienced trauma, they will be acting out. They will be doing unusual things that you have to pay attention to. And you will recognize that, wait a minute, something has happened. You have to set yourself to watch the risk factors in children and when to access mental health care for your children. You know, even with self-esteem issues, you may not think that's important because your daughter doesn't like how she looks or doesn't feel good about herself. But it is important that you get them the support that they need, because that could lead to further developmental mental health issues because we fail to address issues when it was just a small issue. You know, it was small to us but big to a teenager. If they don't like themselves, if they're constantly down in themselves, if they keep thinking their body is ugly, or they're ugly, or they're not smart enough. You want to look at that. You want to make sure that they're developing and that they're developing socially, and that they're developing healthy self-esteem. So access mental health care for your kids, access mental health care for yourself. Now let's talk about the geriatric community. You know, a lot of times we don't realize when people start with early stages of dementia, it can be devastating to a family. It can be devastating to your loved one that has been recently diagnosed with dementia. So I think it's important to try to connect, not just with your physical doctor, because to see a loved one go through the stages of dementia and then finally to Alzheimer's can be very painful and can be very hard on a family. When you're used to seeing that loved one vibrant, you're used to seeing them cognitively functioning at high levels, you're usually seeing them being able to physically move about and be free to move about. Remember that access to mental health care is not just for middle-aged people, it's not just for children, it's not just when your children get addicted to drugs or get caught up with the wrong people or in bad relationships that have influenced them, like I was as a sophomore in college. But it's also for the geriatric community. Some of our nursing homes or nursing care facilities have providers that come into them, but don't think that you can't bring your loved ones in, because they can definitely come in and access mental health care to talk about what they're going through and the care that they need as they're going through the various stages of dementia or going through other chronic health disorders. Even if your family member, maybe it's not initiated because of a mental health disorder. Maybe they were diagnosed with cancer or diagnosed with some other physical health disorder ailment that has altered their lifestyles, and they don't know how to deal with it. Perhaps it's a young man or man that has worked all his life, and all of a sudden he's diagnosed with something acute or chronic and can no longer provide for his family. and it's having an effect on him. And you recognize that, or an example, they're starting to drink more, they're starting to experiment with drugs or using drugs that they've never used before. So you want to, you want to reach out and you want to try to get them connected. Try to get them connected, and mind you, we may not have a lot of resources in Wayne County, but I feel like as far as mental health and behavioral health, I feel like we are blessed in Wayne County. We have several great clinical offices that can provide services. And I was going to mention too, with access and mental health care, remember that even if you don't have insurance, I want you to remember this, that remember if there is no insurance, providers, I know our office is willing to work with you. We have what we call a sliding scale. I do believe all of the offices do. And I want to remind you that Pineland Mental Health is a state-funded agency. So you should be able to get any mental health service that you need with Pineland Mental Health because it's state-funded. And your inability to pay should not be an option. My understanding, it should not be an option. And if you come to my office, I have a sliding scale. I'm not sure about Anchored in Wellness. I'm sure they have a sliding scale of some form. If you don't have the ability to pay, we just look at certain criteria. We may ask you for some bills. We may ask you for some recent pay stubs to determine the amount that you pay. And then some people don't want to go through that eligibility process of the sliding scale because they don't want people to know what they pay, what they make, or they don't want to bring in their utilities or bills like that. But that's just something we have to do to keep a consistent fairness across the board. We wouldn't charge you one thing and charge somebody else totally different. Our services are consistent, the pay is consistent, so that's why we do it. We do it that way so that the pay and all of that can be consistent. So what I want to do just right now, I recognize we don't have any questions this morning. I think we may be doing Let's Talk Mental Health too early or something. But Vicki and I are early risers, so we hope that this replay.
That's right.
We're hoping that it replays for you because our day starts early too. But I wanted to do this because I recognize my 30 years in mental health and providing mental health care to just community counseling, to my military family, to veterans. I wanted to do this because COVID-19 has so increased our mental health needs, and I wanted to make sure that I was giving back to my community that I've been in for 26 years. No, I'm a transplant, but I have been here 26 years. I wanted to make sure you knew where you could get the help that you need. Now, accessing mental health is not just for mental disorder. I want to talk about substance misuse. All of the clinicians, all of the providers that I mentioned earlier, Wayne Behavioral Health, Pineland Mental Health, Anchored in Wellness, and there are several substance use, misuse facilities around here that provide substance misuse recovery programs and processes. We are a dual diagnosis agency, as is all the other ones, all the other providers. So when you think about mental health is encompasses of mental disorders, but also substance use is one of those. So we're dually diagnosed agencies. We dually diagnose, we dually care and treat. And so we like to talk about prevention, we like to talk about education, but we are treatment providers also for substance use and misuse, okay? I want to remind you that Wayne Behavioral Health is one of the only, I think we are the only agency that provides the DUI substance use treatment in Wayne County. So if you get a DUI, we provide the treatment, and we're also the clinical evaluators for DUI in Wayne County to try to help multiple offenders get their license back, and we have been a provider for 20 years here for the state of Georgia. So we are on the state registry to provide treatment and to provide clinical evaluations. which take place only after we don't see you if you've had one DUI, we see you've had multiple, 2 or more DUIs. And let me just tell you that accessing that kind of care, we don't treat you as you're just a DUI offender. We'll assess you for the issue, the substance misuse. The drinking and driving was just what you got caught doing, but we need to find out if you have an issue. So then you would go through the same clinical evaluation process as you would if you came in, if you were depressed, if you were struggling with anxiety, if you were struggling with grief and loss, which are some of the top 3 things now that we're seeing. Anxiety, number 1, depression, and also grief and loss. And so you know, we would recognize and want to evaluate you for those things. Good morning, Facebook. Thank you for joining us this morning. Good morning. Thank you. Do you guys have any questions? Anything that I'm not talking about that you would be interested in? We're talking about this morning, Wayne County, we're talking about accessing mental health care, and also we're talking about the risk factors of suicide because of Suicide Prevention Month. I want to remind you that our urgent mental health care lines, our local line is 912-318-3317. Our Georgia Crisis Hotline is 1-800-715-4425. Georgia Crisis Hotline, 1-800-715-4425. Suicide Prevention Hotline, you can call 1-800-273-8253. And if all else, if you're feeling overwhelmed and you need help immediately, call 911. If you cannot access care from anyone else, call 911. And those professionals know what to do and how to do it, right? And they will support you through the process. So I think, Miss Vicki, are we going to any announcements on your side?
No, you can close it out.
Okay, great. So I want to thank you for joining us this morning. And next month, let me share, we're here on the third Friday of each month. Next month, we're going to be talking about adolescents' substance use. Because it's Red Ribbon Month, October the 18th, I believe, is when we're going to be back here with Let's Talk Mental Health. But we're going to focus on adolescent substance use. As you know, Wayne Behavioral Health received a grant from the Wayne County Substance Abuse Coalition recently to jumpstart the OAKS, which is an adolescent substance use and misuse program for adolescents only. From ages 10 to 21. So I know that's young adults, but we wanted to go up a little bit. So we will be, I want you to know that that's a resource in Wayne County that we provide treatment, evaluation, and care to adolescents struggling with addictions. Don't be in the closet and don't think your children are not getting high. They are. Young people are getting high, they're using, they're vaping, they are smoking marijuana at an alarming rate. And I would say some are even crossing over to trying heroin and trying some other things. So we don't want to act like we don't see. And I know it's painful to see, but we want to get our young people the help. Because what I was trying to get to earlier was, a lot of times we don't want to accept that our children need help and end up allowing them to go throughout their lives without mental health care and not accessing help to when they're adults. Some of the stuff we could have prevented from when they were children. So don't be ashamed that your kids need help. And so, like I said before, there are great programs here. There are great programs in the community that are doing great things. So let's support our children. Let's support each other during COVID-19. Let's access some mental health care. Let's protect our mental health as much as we would protect our physical health. Let's, as we work out our physical bodies to stay physically fit and healthy and all of that, let's work out our mind and let's work out our thought life, so that we can have healthy mental health. So thank you for joining us today. It has been awesome. I'm honored, I'm privileged to be able to sit and share with you about various issues as it relates to mental health. If you need us at Wayne Behavioral Health, you feel free to call us at 912-385-2627. We're here to help you, and if we can't help you, we'll coordinate the service to get you the help that you need. We know that we're not always the perfect fit for everyone, so we try to find the person that is your fit to support you through the process, to make it easier, to remove the stigma, and to support you. Have a good day. Be safe, Wayne County. Wear your mask. Wash your hands, and social distance, and let's get rid of COVID-19.
Yes,
Have a
ma'am.
good day. Thank you, Miss Vicky.
You're welcome.